Let's just talk about so there's traumatic arrest. Trauma caused it. But at its core, it's still a cardiac arrest, right? So what are the two? There's two completely separate, because I don't know which one of you guys said the words in there that made me really want to go down these two pathways here. So there's two separate rhythm pathways. So it was the word pulseless, I think you said, right? So the patient's pulseless. They're dead. They've arrested. So it's what can we do to intervene to fix that? Now, the most common way you're going to die for a regular situation is a heart attack, okay? Which rhythms do heart attack cardiac arrest typically go into? Because they're both pulseless. Exactly. So that's over here. So think pulseless V-fib and pulseless V-tach in a true medical. I had a massive MI. I was at the mall walking around with my family and I collapsed. What would you do? CPR. Yeah. Well, so you as the person, hey, you, call 911. Hey, you, get the AED. I'm here. Boom. The best thing you could do is jump on their chest. They have no pulse, jump on their chest, call 911, get an AED. This is your medical one, okay? If a trauma patient arrests, are they going to be in V-fib or V-tach? No. What are they going to be in? You just kind of see. Yeah, so they're going to be in PEA or asystole. What's PEA stand for?
Pulseless electrical activity.
Yeah, so pulseless electrical activity, and it tells you exactly what to do on this side of the rhythm. Push epi always. Okay? Super simple. Okay? So this side's PEA, pulseless electrical activity, and asystole, and it's push epi always. So all you do here is push epi during your code, and then the theory on this side is, have you guys heard of this? The H's and the T's? So you're trying to figure out what caused it. And basically, at the end of the day, it's anything that causes shock. Okay? Just like all of our shock talks. So in trauma, what's an H? Hemorrhage. Yeah, hypovolemic shock or hemorrhage, right? They're bleeding. What's a T? That's a good one. Trauma, yeah, that's actually a really good one, sure. Trauma causing bleeding, H-A-N-T, yes. So tamponade, cardiac tamponade, tension pneumo, thrombus, meaning a large PE, or even thrombus in your coronaries, but again, that's kind of more over here. What are other ones? Again, all things that are causing a shock state to then cause somebody to lose pulses. Here is different, because what's built into this algorithm that's not just as simple as this?
Shock defibrillation.
Yeah, so we have defibrillation here, defibrillate them, electricity, deliver a shock, and epi, exactly. And then the other big drug that makes a big difference over here is amiodarone, okay? So this pathway is a little bit different than this pathway. And then let's just separate out what defibrillation versus what's the other term?
Cardioversion?
Yeah, electrical cardioversion. And who's the patient? Because we actually just did that the other day. We see this a lot more often in the ICU in our setting for which underlying rhythm? AFib. Yeah, so unstable AFib with RVR, rapid ventricular response. So someone's hypotensive or has altered mental status or is actually in shock. This is a type of cardiogenic shock from the underlying arrhythmia, which means the way to fix this is synchronized cardioversion. Pulseless V-fib, V-tach is defibrillation and delivering a shock, and this. Two separate things, two separate pathways. Different in your mind, okay?